medical reports, physicians often start with a one-sentence summary of the patient they're writing about. As I read these descriptions, I often find myself drawing up a mental image of what that patient could look like as I learn about their age, gender, and diagnoses. I'm going to give 2 examples of how a report might start, and I want you to think about what this patient could look like. Mr. X is a 78-year-old man with a history of type 2 diabetes experiencing chest pain. Now, the second version is, Mr. X is a 78-year-old retired school teacher with a history of type 2 diabetes experiencing chest pain. What did your mental image of these patients look like? Were they the same? And if they were different, is there one version that you feel more comfortable approaching? Often our healthcare system becomes preoccupied with patients' diagnoses and treatment plans and fails to acknowledge that patients are individuals with diverse backgrounds, experiences, families, and friends. These personal details may seem trivial and extraneous. When your job is to diagnose and treat, and you have a lot of patients to care for, does it really matter who the patient is? You're overworked, tired, but you're getting the job done. Is there any benefit to standing there listening to Maggie about her 4 grandchildren or how Sam's favorite hobby is surfing? A pilot program at the Yale New Haven Hospital studied this by requiring internal medicine residents to elicit a personal fact from each patient and writing it at the top of each admission note. The placement of the fact at the top was to emphasize that each patient was first and foremost an individual, and the purpose of the program was to restore personhood to dehumanize patients. The study found that by simply asking for one personal fact, the patient-doctor alliance was improved, and patients became more amenable to treatment. This also benefited physicians, as empathy has been found to improve physician satisfaction, whereas apathy toward patients has been found to lead to fatigue and burnout. This past year, I had the pleasure of working on a project where medical students are paired with caregivers of children living with health complexity in creating a MyBooklet BC care plan. MyBooklet BC is a strengths-based care plan that not only outlines the child's diagnoses, but what that diagnosis means to that child and their family, as well as the child's needs versus wants and their strengths. Medicine often focuses too much on the negatives. The patient is not meeting developmental milestones. They are not able to speak in full sentences. They cannot walk without support. This is helpful for diagnosing someone and tracking their progress over time. But imagine how it feels if everyone around you only ever talks about what you can't do. I loved speaking to parents about how even though their child needed help with daily activities, they also loved holding hands with people, or listening to music, or shop for gifts. I learned through pictures and anecdotes that these children were so much more than just their diagnoses. And my heart broke when I heard stories of those same children only being seen as their medical condition, someone who needed gait aids, or someone who was just difficult to communicate with. Everyone in this audience has something that they love to do, people who they love and who love them. When someone asks you who you are, I'm sure several descriptors come to mind. But at any moment, you could just become the asthma patient in room 110, or the broken arm in the trauma bay. These phrases can be an efficient way for healthcare staff to keep track of everyone and remember their patients. But if you keep saying it, at some point, how does that affect the way that you see that person? If that patient were to hear something like that on one of the worst days of their lives, how would it make them feel? My dad has schizophrenia, and growing up, there were many visits to the hospital. He was not an easy patient during his episodes. Sometimes he was very loud, and other times he refused to talk at all. He was delusional, agitated, he didn't want to take his medications, and he was wary of those who tried to help him. During one of his admissions when I was 17, I went to go visit him. I asked someone on the psych ward how he was doing, and they told me they would go ask his nurse. I sat down at a chair nearby, and I waited. I was looking down at my phone when I overheard someone say, "His daughter's here to visit." And another voice replied, "That guy has a daughter who came to visit?" and my heart sank down to my stomach. This man who had raised me for 17 years, who I called Dad, had become that guy. And the way it was said revealed so much. I remember feeling embarrassed, although I had no reason to be. I wanted to hide, knowing that I wasn't meant to hear that. I was angry at the way it was said, and I was worried about how he had been treated since he was admitted. I know they wouldn't have said it if they knew I could hear. And I wonder if they would have ever said it if they knew that that guy had 2 daughters waiting at home. I cringed at the thought of what I would say to my younger sister, who was only 9 at the time, when she asked where Dad was or how he was. And all that would be echoing around in my head was how that guy was said. I'm starting my 3rd year of medical school a week from today. It'll be the first time that I'll be in a clinical setting full-time. So basically, I'm at the very beginning of my training. I've only heard of or seen from the outside what long shifts look like. I can only imagine how exhausted I'm going to be after a 90-hour week at the hospital, and I know for sure I'll be an absolute grump when it happens. But no matter how emotionally and physically exhausted I am, I really, really hope I never forget how I felt when I heard that guy, or how I felt when parents would light up as they got to tell me about how their kid loves to dance or look through Costco flyers for fun. And this is my hope for healthcare, that we keep in mind who we're treating, not just what we're treating. Because I've seen how much it means to someone to be recognized as more than just their diagnosis. Thank you.